Today's topic will be all about how to handle emergency situations in the field. Okay, so every site, every college, university, high school, as well as every venue within that site has a specific emergency action plan for each location. So this is going to be a plan for what to do in an emergency and should cover everything that you need to know. So this will have a plan for equipment removal, so how to remove helmets, shoulder pads, how to spine board an athlete, etc. Where phones are and is there good cell phone access. So lots of times campuses will have phones placed around the different venues for emergencies. We need to know the community-based system, so we need to know where the local hospitals are, how long it takes for an ambulance to get there. We need to have keys to gates and access roads. So if there's a hospital that's coming in off of a different road and the gates are closed, you could lose valuable time for helping that patient. The staff needs to know that they have to plan and review this annually, so they should know all the ins and outs of the plan. That way, when there is an emergency, which there will be one, no one is confused and everyone knows their role and what to do. Contact information always has to be available, so everyone's contact list from coaches all the way up to us medical staff. And then we also work with local EMTs and fire response because lots of times they will get there first. We will tell them that we want to spine board our athletes instead of them. We'll tell them that we have splinting techniques and we can do the open airways, CPR, etc., and that they're there just for extra support. Or in smaller, more rural locations, there might not be time for fire to get there, so how to transport an athlete to the hospital is very important. Okay, what we do first, we do the on-the-field assessment. So our primary survey of an unconscious athlete is going to start with our ABCs, airway, breathing, and circulation. Then we're also going to look for shock and any profuse bleeding because that also has to be stopped right away. We will call 911 immediately, and then we will care for our patient until extra help arrives. Okay, how to check for airway, breathing, and circulation. First, we're going to check for breathing. So to do that, we're going to open the airway with the head tilt and chin lift. If you are CPR certified, you've learned how to do this. If not, this class is not teaching you how to perform any first aid or CPR. It's just going to give you ideas as to what you might see if you start to take some of these classes and volunteer with us on campus. So to check if someone's breathing, we're going to place our ear over the patient's mouth. We can also observe the chest rising and falling. We're going to look, listen, and feel. And then if needed, we will use our barrier mask and rescue breaths. We are going to check the pulse at the carotid artery, which is the one on the side of your neck, and always have an AED available in case there are any issues with pulse or that there's no pulse and that we can assess them with the AED. I mentioned that we're going to look for signs of shock. So we have blood pressure cuffs. We can take the blood pressure of a patient. So low blood pressure would be below about 120/80 or below 100/60. Anywhere below that, especially when someone is doing exercise and working out, it should be a little more elevated. So we're looking for that systolic number to be below 90. Pulse will be very rapid and weak. So normal pulse is about 60 to 80 beats per minute. So pulse would be more rapid than that, but when you feel it, it would feel very weak. It would not feel like the strong bounding pulse that you probably feel on your neck or on your wrist when you're working out. The athlete can appear drowsy or sluggish, not having their normal energy. Their respiration could again be rapid but very shallow. Normal breaths per minute is about 12 in an adult and 20 to 25 in children. So with an adult breathing a lot faster than 12 and very shallow, that could be a sign of shock. And of course, their skin could be pale, cool, and clammy, which when someone is exercising or working out, usually they're a little bit flushed, a little reddish tint in their face. They're not going to feel cool, they will feel warm, and they won't feel clammy. We also have to look for any profuse bleeding because that could be causing the shock symptoms, that could be causing loss of circulation or issues breathing as well. So we will put direct pressure on if there's any bleeding on the body and try to elevate that area as well. There are certain pressure points in the body that we can use to help slow the amount of bleeding. So for instance, if someone has a fracture on their lower forearm, it's broken the skin and that area is bleeding a lot, we can use a pressure point in their brachial artery, which is up in your bicep on your upper limb and your humerus. On the medial aspect, we can put pressure there to help slow the amount of blood that's coming from the wound lower down on the arm. We also have one in our medial thigh called the femoral artery, where we can put pressure as well to try to slow bleeding further down the leg. On the field assessment, we need to see if they're conscious. If they are, we can do our secondary survey, which is when we're taking their vital signs, their history, we're doing a full musculoskeletal evaluation, and then we talk about treatment considerations and transportation off the field. But again, this is only if they are conscious and stable. Secondary survey, we are using it to determine the seriousness of the injury, so how severe it is, the type of first aid that we might need. Maybe it's not that severe or profuse bleeding in the forearm, but they do have some cuts or lacerations or a broken bone, so we still need first aid. We need to decide if we are going to do a physician referral right away, so refer them straight to their doctor, an urgent care, or a hospital, and the type of transport that we might need. Okay, when we are looking and taking someone's vital signs, these are going to be the average normal vital signs for a young, healthy person. And again, they could vary person to person, but this is the average. So for pulse, normal is about 60 to 80 beats per minute. Respiration, we talked about 12 breaths per minute in an adult. Blood pressure, 120 over 80, sometimes 100 over 60. That's all considered normal. Temperature is about 98.6, 37 degrees Celsius. And then we have certain skin colors that can determine different illnesses with our patients. So this is not just talking about someone's generic skin color when they're normal and healthy. This is talking about when they have an illness going on. So if they have a very red tint to their skin, this could indicate heat stroke, very high blood pressure, or high temperature. If they are looking more pale or slightly grayish color, more than normal, then they could have lack of circulation, they could be in shock, or heat exhaustion. If they're looking bluish, so their lips or their fingernails have a bluish tint, even sometimes their face, they could have an airway obstruction or some sort of respiratory insufficiency, which means they're not able to breathe properly, which means they can't oxygenate their blood, and that's why they're starting to turn that bluish color. We can also check pupils. We want to make sure they are equal and reactive to light. So what this means is that when you shine a light, usually it's something mild like a pen light, in one person's eye, both pupils should constrict equally and at the same rate and size. So not just the pupil that has the light shining on it, but both eyes should respond the same. So if you're checking the left eye, both pupils should constrict and vice versa. State of consciousness, obviously the normal is that someone's alert and aware of their environment. They can respond quickly to vocal stimulation so they can answer their questions. They know their name. They're not confused or dizzy. Weakness of movement, so you want to check one side versus another. You want to check things like grip strength, and then also move on to sensory changes, so things like numbness, tingling, or complete loss of sensation. You want to check bilaterally, side to side, and make sure they don't have any weakness or sensory changes in their body. We go through our HOPS exam as well, history, observation, palpation, special test. So when we're doing our history, when they're conscious and safe, maybe transported off the field onto the sidelines, we can do the thorough, what happened, has anything happened before, what'd you feel, what'd you hear, all of that. Observation, so did you actually witness the incident? Did you observe the area and all the surrounding areas of the injured area? So you're looking for swelling, any bumps, bruising, changes in bone contours, etc. palpation, so feeling the structures involved and always comparing it to the opposite side, so comparing bilaterally. And our special tests are going to be specific to that joint arm muscle to make sure we are stressing those structures and figuring out what's actually damaged. Treatment considerations, we learned about RICE. Now we're adding a P in there for price. P stands for protection. So when we are transporting someone, especially off the field after an injury, we need to make sure that that area is protected first. If someone has a broken bone in their foot or a very severe ankle sprain, I'm not just going to have them walk off the field. I'm going to splint it properly and then transport them off so they don't have to put any weight or pressure on that area. So protection is very, very important. Lots of times it has to do with splinting, with splints, things like SAM splints, cardboard splints. We'll get into a lecture on all of that. And then also elevating the area before we move them off the field. So for field removal, we do have lots of ways that we can do that. Spine board would be if we suspect any sort of injury with their spine, all the way up from their skull down to the base of their spine and their hips and pelvis. We would use them on a spine board. We also have things like ambulatory aids like carts, a sports chair, which is like a wheelchair that can go over rough terrain. We have a large sports medicine cart on our campus where someone can fully lay down on the back so we can drive it out to the field if need be, transport them safely, and then drive them off. We will always refer to a physician. And then there's always the debate of, is this an emergency where we need an ambulance? Or is this something more mild and less severe that we can splint it and send them with their family? Lots of times, fans, parents, spectators, or even coaches want to automatically call 911. But if it's not life-threatening, we shouldn't be doing that. If it's just a broken bone, something easy that we can splint, and there's no respiratory or circulation issue with that athlete, all we do is splint the injury, and then we will have someone drive them either to an urgent care or an emergency room, but we won't waste the services of an ambulance if it's not truly a medical emergency. Okay, this week we have a lab where we will be taking vital signs of someone within your household. So anyone, a sibling, a parent, a roommate, etc., is okay for this lab. You're going to follow along on the next slide's vital signs and perform each assessment on your patient. I have posted 3 videos in this week's module that you do need to watch before you perform these. It's very important that you do these correctly and safely, so I want to make sure you watch those first. You're going to turn in your lab under this week's module assignment. It's called the Vital Signs Lab, and it is due this upcoming Sunday, March 21st by midnight, and it's worth 10 points like usual. And there is a template under this week's module for reference on how to complete the assignment. So please be sure you are looking at that. There's a whole template to fill out. Everything is under this week's module. Okay, so vital signs, you are going to check the pulse of the carotid and radial artery for 1 minute. Again, see the videos. We will count respiration for a minute. We won't worry about blood pressure or temperature. You can take that if you have a thermometer or a home blood pressure cuff, but those aren't common. We're going to classify their skin color as normal, red, pale, blue. Look at their pupil size. You'll see how to do that using a phone light. We're going to assess their state of consciousness. Hopefully everyone is alert, awake, they're aware of everything, and they can speak back to you. We're going to check their weakness, so having them squeeze your hands and both of their hands and make sure it's equal on both sides. And then sensory, you're going to make sure you're feeling both sides, and I have explained that on the lab for this week.